All right, so this will be your essential setup for Vincristine, right? With Vincristine, you're not going to have more than 1 ml of the drug, unless you have some crazy, like 250-pound mastiff, then you might get over 1 ml. But a general rule for Vincristine, which is what you guys would give in the ER for like ITP, is that you shouldn't have more than 1 ml. So a small dog should be in the range of like 0.1 to 0.3 mils. If you're getting up into your Labradors, big pit bulls, you might be in that 0.6 to 0.8 range. So just a good volume gauge for how big your patient is, to help you keep your doctors on track too with their dosing, as a lot of the ER docs aren't as familiar with chemo drugs. So for a Vinc administration, you're going to want your drug syringe, flush syringe. Usually I say to at least have 12 mils of saline for flush. You can do 20 if you want, if you're on a big dog, but for like a cat that doesn't have any heart issues or anything, we're not afraid of fluid overloading them. I suggest between 8 to 12 mils of flush. So with that, we'll pretend we have our bottle here. To attach your injector to your syringe. So just think of this as your needle. We're not using needles, but think of this as the needle, just so you have it in your brain of what it is functioning as. So you always want to use lure lock. Everything under the hood there is lure lock. Don't use a slip tip, that is going to potentially increase your chance of exposure. And so those just lock onto there. And this is the most annoying part that people struggle with, is how this actually works. So you have grooves in there and your nubbies that are going to line up with that. So you just line up your nubbies. You always want to hold by this, where the little finger divots are. If you hold here, it can just spin. This is what is going to actually attach, so you don't want to hold by the blue. So always hold by that whenever you're doing anything with the injector. So we line up our nubbies, and you want to push. Most of the time you'll hear that little click. You're going to twist to the right and push. And then you are fully connected there. You can draw out whatever volume of drug you need. And then we're again going to hold by that, pull, twist, pull. So push, twist, push, pull, twist, pull is how we're disconnecting and reconnecting that. They do also have these already like prepped under the hood there, but you again want to use a lure lock T-port, not a slip tip T-port if you guys even have those. And you're going to connect on one of these little doohickeys, the lure lock connector. That'll just screw on to the tip of your T-port, and that's just going to allow you to use the Phaseal system with a normal T-port. And so for a Vinc, this should be the basic stuff of what you have on your chemo pad. And again, you can use saline with all these drugs to flush. And so you just want to pre-flush your T-port. You'll have your flush itself and then your drug drawn up. And as far as administering, you want to have a perfect stick catheter. That means zero redirecting whatsoever. You are just popped straight in the vein and in it goes. The drugs can cause tissue damage outside of the vein. We do suggest when you tape in that catheter to tape it as such that you can see the actual insertion point of the catheter into the skin. And so when we do that, I usually just tear a 1/2 inch strip of tape, and you're just taping it as securely as you can right below, so you can still see right where that catheter is in the skin. And that's just the best way to monitor if there is any blowing of that catheter or extravasation, anything like that. And then you want to, of course, flush first. Make sure your catheter is patent. I always suggest pulling back to get blood back. Even in most cats, like in a cephalic vein, you can still at least get some blood to come back into the hub. Just another good confirmation that you are in the vein. And so flush, make sure it feels great, you don't have any concerns, and then you'll disconnect your flush, hook up your Vinc syringe, and you can just give it as a push. It's a tiny amount. You don't have to try to, make that tiny amount go over a minute, anything like that. You can just push it and then hook up your flush syringe again and flush. After you have given the drug, you do not want to pull back for blood, because then you're going to get some of that Vincristine back into your flush syringe, and which defeats the purpose of flushing it at the end to make sure there's nothing in that when you pull the catheter. And then after that, once you flushed, everything's good, you can remove the catheter. Everything that has chemo, flush, anything like that can go in here and should be disposed of in one of the yellow bins. If you are going to keep the IV catheter, because a lot of those ITP patients have already been poked everywhere, you might need to keep that for their treatment in the hospital. With that, when you are disconnecting this, make sure that you have all of your gear on still, and you want to disconnect that and wipe this port with alcohol really well to get any potential traces of chemo that may be on that. And then at that point, if you have taped it where you can see that insertion point, I think it's fine to add more of a normal tape job so that that's really secure for them being hospitalized. And you just want to put, I know you guys have a variety of different like chemo warning stickers. I usually just slap one of those on the catheter so it's really obvious to anybody else using it that it is contaminated. And you just need to make sure you wear gloves when you're handling that catheter. Ideally, of course, we want to pull it, but again, those ITP dogs don't usually have great veins or much left for us to use, and so there's definitely times where we just keep that in. And just making sure anybody that is going to be handling the animal knows that that catheter is contaminated and you need to wear gloves with it at all times. So that is a Vincristine.